Hello, today we're going to talk about managing the cost of cancer care for medical insurance. I'm Angela Young, patient navigator at the Mayo Clinic Cancer Center, and my co-presenter is Amy.
Good morning, I'm Amy Allen. I'm one of the clinical social workers here at the Mayo Clinic in Rochester, Minnesota. Take it away, Angie.
All right, thank you. So today, again, we're just going to talk very high level. We're not going to get into a lot of the individual specifics of each individual patient situation, but really we're going to discuss at a high level what patients need to know about medical insurance. Feel free to write down questions and be ready to ask those at a later time. This is the first of a 3-part series that Amy and I will be presenting on. We want to acknowledge that we're going to be covering a lot of information. Some of it's going to be familiar to you. A lot of it is not going to be familiar. So feel free to write down questions that you can ask at the end or ask questions later of your care team. And we'd be happy to address those. So we want to first start with what is financial toxicity. This is a terminology or a term that you may have already heard, but really we just want to acknowledge that this is very, very common for a lot of our patients to experience at some point in time during their cancer journey. It's basically economic consequences of medical treatment. So financial costs that increase stress that oftentimes come with needing cancer care. This financial stress can leave patients having to make difficult decisions. Sometimes we find patients will skip a test or appointments that are really important for the care teams to have those results. They might split their pills, cut their pills to try to extend them longer, or not spread out their doses, not take them as frequently as they should. Some patients may even refuse recommended treatment just out of fear of how much it's going to cost. And we really don't want patients having to make those types of decisions. And we want to be part of your care and addressing those concerns that you have. And so making sure that you're bringing those concerns to the care team is very, very important. We're going to discuss a little bit further into the presentation who are the key contacts and who makes up your care team. So you'll get a little bit more information about that here in a bit. But we want to acknowledge that with a cancer diagnosis, oftentimes comes some form of reduced income, whether that's the patient not being able to work as often, or perhaps the caregiver who would come with the patient has a reduced work hours, and so that is a reduced income. We also acknowledge that there's a lot of new expenses that come with a cancer diagnosis. So you driving a lot more to and from medical appointments. That might be that you need to stay closer to the medical facility. So you might have lodging costs. Probably some new medications that you weren't regularly taking before. Those are all going to come with some co-pays that you're going to have to pay for. New expenses for over-the-counter medications that need to be taken. Some of these are covered by insurances, some are not. But acknowledge that all of this at the end of the day comes out of your daily family budget. And when some patients have a tight budget to begin with, this causes this financial stress very early on. Some patients, this comes later on in their cancer journey. So there's no real good time to say that you can expect it at this certain time. We just say it can really happen anytime. And so we really want to open this conversation up in that you let your care team know at any point in time along the way of any concerns that you might have. Amy, do you have anything to add?
No, Angie, I don't have anything to add. I would just highlight that, this financial toxicity can really happen to any patient, any family. It doesn't judge who we are or where we lived or what we did for careers. And so really thinking both what are you struggling with today and what you might be struggling with in the months ahead. And please, please tell your providers, nurses, whomever on your care team, because we really want to be here with you to help you think through some resources or some ideas that might help minimize that. Again, like Angie said, one of the ideas could be just how does Mayo partner with you and maybe a local provider to do some things there and some things here.
Perfect.
Go ahead, Angie. Yeah, you're welcome.
So medical insurance concerns, again, that's what this presentation is going to be about. I think the thing Amy and I both want to stress is this is very, very common for patients to have some type of an insurance issue, a little bump in the road along the journey, whether that is early on with testing, or it might be some issues with insurance coverage when we get to the point of recommending treatment. But as your care team, we are well aware that these things happen. We're to some degree anticipating that this will happen. And we want to walk alongside you and support you. Again, conversation, open communication with your care team is what we want to really, really stress here, so that we don't have any delays in care and we don't have patients paying for anything that they shouldn't have to be paying for. So real briefly here, we're going to go over some of the health insurance vocabulary. There's a lot here on the screen, a lot of terms that if you're not familiar with, Amy and I both feel like these are the things that you should become more familiar with. So we're going to go over these individually and kind of, I'll explain a little bit more the definition of each one of these. Again, if you need further explanation or have more questions, please write those down along the way. But this is the terminology that your insurance company is going to use with you. And so to some degree, we want you to be familiar with these terms and get familiar with these terms so that you understand what the insurance company is explaining to you when you call and make questions, or they mail you letters, or whatever communication they provide you. So I want to start with the cost to have insurance is what's termed as your monthly premium. So that is what it costs you to have your insurance. A good number of patients have insurance through their employers. And so they oftentimes pay just a percentage of the actual cost to have insurance, and their employer might pay another portion. And for many patients that have employer-based insurance, you have that removed, automatically withdrawn from your paycheck. So I think the thing that Amy and I really, really want to stress, and your care team really wants to stress, is if you have a reduced work schedule and you have reduced hours and you're not getting a full paycheck, at the very least, have a conversation with your employer around, how do I pay my monthly insurance premium that's automatically deducted out of my check? Because we don't want you to have a lapse in insurance. And so having that conversation early and making those plans will ensure that you stay insured that entire course of your cancer treatment. But again, the monthly premium is what you have to pay to be insured. Sometimes you're insuring yourself, sometimes you're insuring a family. So some of the terms that are oftentimes used by insurance companies are annual deductible. The annual deductible is the amount that you, as the patient, must pay in a calendar year before your insurance plan starts to pay. So that means if you have an annual deductible of $500, that means you are going to pay the first $500 before your insurance company will pay anything. So it's what you have to pay. It's your responsibility. And then you have the copayment. So your copayment is a set dollar amount that you pay each time you use a covered service. So that might be a doctor's visit, or picking up a prescription at the pharmacy. You have a copayment to see the doctor. You have a copayment to pick up your medication. Your coinsurance is the percentage of the total cost that you're going to have to pay for the service. So if your insurance plan is an 80-20, which means insurance covers 80% and you cover 20%, that means that co-insurance is your 20% of the cost until you hit your out-of-pocket maximum, which is the next term on the screen. Your out-of-pocket maximum is the most you're going to have to pay for covered services in a plan year. The thing I want to stress here is that you do have in-network and out-of-network out-of-pocket maximums with many insurance plans. So make sure you pay attention to that you're in-network or out-of-network, and that you're looking at your out-of-pocket maximums. But that is what you will pay at maximum before your insurance company should start picking things up at 100%. If we jumped onto the other common terms, so explanation of benefits, those are the statements that are provided to you by your insurance company that usually explains what charges were sent from the medical facility to your insurance company. They reviewed and they paid X dollar amount. And then if there's anything left over, that's your patient responsibility, that is then sent back to the medical facility. And then you will have a balance or a statement with the medical facility. Your explanation of benefits usually will come to you via the mail and paper form, or they may be electronically sent to you or via a portal, whatever type of communication you have set up with your insurance company. In-network versus out-of-network is so very important to understand. So your insurance companies have in-network providers and out-of-network providers. You will have the best coverage if you are in-network versus out-of-network. You're out-of-network, you are going to have more out-of-pocket expenses. You're going to have to pay more for your insurance or more for your costs of your cancer care because your insurance is going to pay less. We have seen where some out-of-network providers, it never is an out-of-pocket maximum, which means you'll pay forever if you don't get to an in-network provider, which is why we will encourage along the way that we are checking to make sure you have checked to make sure Mayo Clinic is in-network. Itemized or monthly statements, itemized statements, those are two similar terms. Those are what will come to you from the medical facility that will say these are the charges that were sent to your insurances. And then it will give you if there's a balance that you owe. Open enrollment is a time where you can choose to change your insurance company. Oftentimes this is in the fall. And this is a time where you can elect to choose a different insurance so that you can look for better coverage if you have an opportunity to choose different coverage that would cover you better. Most times this is again in the fall to start again, a new plan would start January 1st. There are some times where other employers will follow not that fall open enrollment time period. It might be more in the middle of the year. So I would just say reach out to your employer to ask when your open enrollment plan is. Prior authorization. This is where we actually will seek to check to make sure that your insurance company will authorize you to proceed with whatever test or authorized to proceed with whatever treatment is being ordered. It's not a guarantee of payment, but oftentimes this is a step that insurance companies require us to do. Then there's medical necessity. So medical necessity is where the insurance company will decide whether or not a therapy is justified or reasonable or appropriate based on the standard of care. And if they come back as saying, nope, it's not medically necessary, again, we'll get a little bit more into that in future slides, but this is where the care team will become involved and will help along the way. And then we have COBRA, which that is an option for you to have insurance, keep oftentimes employer-based insurance after potentially a loss of job or transitioning over to long-term disability, but you are responsible for the entire insurance premium. So for many patients, it's cost prohibitive for them to do COBRA, but sometimes they'll do that temporarily until they can determine other insurance care. Amy, what would you add to this insurance vocabulary?
Yeah, I don't know that I would add anything. I would just maybe highlight that, really it's super important that you understand what you owe to maintain your insurance coverage. We really want to help support you in not having a gap in coverage. Also really want to add and highlight that the explanation of benefits, it's not a bill. I don't know how many times over the years I've gotten calls, I've gotten 7 pages and it's $100,000 on it. And breathe, it's not a bill. It's just an explanation of your benefits. And then really understanding, going back to the cost to use, really understanding what's your copay insurance deductible. You can do that a couple of different ways. If you are a hoarder like me, you can go back to your policy and it'll be in there. You can also call the number on the back of your insurance card and call the insurance directly, ask them what are those numbers. You can even ask, where are you at already this year in meeting those financial expectations? And then the last thing I would highlight is really understand, where are your in-network facilities, where are your out-of-network facilities. This presentation is about financial toxicity. That is one of the best ways to help decrease your financial toxicity, is by getting care in an institution that's in network. So I would just add those, Angie.
Thanks, Amy. Okay, so oftentimes with cancer care, we anticipate some denials. We don't know really when those denials will come or when those little bumps in the road will present themselves, but it is something that as a healthcare facility, we do expect. And so with that, we are prepared to support and walk alongside you to kind of address those denials as they come up. Some common reasons for denials that patients may experience during their cancer journey is that perhaps prior authorization was not obtained. And that could be that we weren't aware prior authorization was needed. Regardless of what the issue is, we have ways that we can fix that. We just need to know that that's the reason for the denial. Sometimes we get denials because you're deemed as out of network. And so we need to address, okay, do we need to look at getting you treatment in network, or do we need to look at working through an appeal process for in-network coverage? Again, engaging the care team would be necessary to address this. Sometimes denials will come back for not covered services, or things like the test or treatments considered investigational, experimental. Sometimes they'll tell us it's not medically necessary. Again, all of these things will be the care team, your physician, your nurses, your team will help along the way. The things that you can do as a patient is make sure you call your insurance to make sure Mayo Clinic is in network. I cannot stress that enough. We want you at an in-network cancer center. As Amy said, there's going to be out-of-pocket expenses with this cancer journey. We're looking to find ways to limit those so that you have the least amount of out-of-pocket expenses. And so by making sure you're in network is step number one, because medical costs are very expensive. And so anything we can do to minimize those. Notify your doctors immediately of any denials that you are made aware of. We usually get a notification of a denial But sometimes you as the patient gets it sooner. And so notify the teams if you get a denial. Be ready to share the paperwork or whatever communication was given to you from the insurance company so that we know how to proceed or what steps to take next. Another thing you can do is advocate with your employer who gives you the medical insurance plan. Sometimes they don't know how the insurance companies are handling these requests for treatment. And many times when they're made aware, they can step in and help advocate for coverage. The other thing you can work with your employer on is just making them aware of issues that come up. Because again, as we talked about, open enrollment happens once a year. Your employer, ahead of open enrollment, is doing research to look and see what insurance plans do we offer our employees. And if they have had many reports of certain insurance that they have right now is giving them a lot of issues and then not covering their employees as they would like, they may choose to go with a different plan. But again, they don't know unless you share with them. So I think it's really important to loop in your employer and make sure they're aware of the issues that you're facing. And then the last thing you can do is request an insurance case manager within the insurance company. This gives you one point person to communicate with. This gives us as a healthcare system the same person to communicate with. Most times you have to make this as a request, and when requested, most times they will honor it or give you a case manager. Sometimes not, but most of the time they do. But it is not safe to assume that you will get assigned a case manager. You do not oftentimes get assigned a case manager. It is something that you do need to request. So those are all things that you can do as a patient to try and help get through this process as smoothly as possible. Amy, what would you add?
Yeah, I would just reiterate, the denials are going to happen. We apologize in advance. We expect that. We know that. Call us, tell us at your appointments what's happening. The more informed we are, the more we can help you get through the denials process, get those appeals, and hopefully get things overturned. Do know that Mayo Clinic has a workflow to help patients with the prior authorization. We often have those wheels already turning, maybe before you even say something. But do know as the patient, it's still your responsibility to call your insurance, make sure those prior authorizations are done, are on file, approved, things like that. And then the last thing I would just say is those case managers, man, they are so helpful. They not only help you, but they really help us. Things along the way might come up that we might need something for you, and it's been kind of a barrier for you to get. But with that case manager, we might be able to collaborate as a team together, the three of us, you, them, and us, as your medical care team, to get that overturned. So advocate for a case manager. I cannot tell you how many times they've been just truly a wonderful link for our patients.
Absolutely. Thanks, Amy. One point I forgot to mention on this slide is when you make phone calls to the insurance company or really to your employer, really anybody, just get in the habit of writing down, taking notes. Who did you call? What day? What time? And who did you speak with? Taking those notes will be very, very helpful if we ever have to backtrack and try to figure out who you might have spoke with on what day. And sometimes it's a timing issue. So just get in the habit of writing down those notes.
I often tell patients, take a notebook, keep a notebook, get a shoebox, keep that on your kitchen island, your kitchen table, wherever, and everything that's insurance related goes in there. It's a nice, safe way to keep things collected and organized.
Perfect. All right. So making the most of your insurance. Again, we cannot stress enough. Please, please, please do not let your insurance lapse. Oftentimes, how insurance lapses is either you quit paying your insurance premium or potentially you may lose a job, which then you lose the insurance that goes with that job if you don't elect to keep that. But really, if there's any concern around the fact that your insurance might be in jeopardy or you might be losing your insurance, that is a reason to have a conversation with the team. Even if it's just like, it might happen, but it may not, we still would like to know in advance, because we'd like to be working through any issues we can and coming up with a plan B. Staying current with those premium payments. So what it costs to have that insurance. Again, many times that goes back to working things out with your employer, if this is automatically deducted from your paycheck, or just making sure you have money in the budget to cover those premium payments, in addition to all the other expenses that are going to come along the way. And if there's concerns around that, then that's a conversation we want to have with you. Know your plan and know your coverage. That goes right into making sure you're using in-network providers, using an in-network cancer center so that you have the least amount of out-of-pocket expenses. Proactively reaching out to your insurance company to ask about prior authorization and whether or not that's required. No, as Amy said, we have workflows in place, but as a patient, it's what you can do to call and say, is prior authorization required? Yes or no. If you get that answer, share that with us. Then we know how to proceed on our side. If prior authorization is needed, we will take care of that. But by you calling in and getting that answer will be very, very helpful. And it will lead to less denials later. Again, we want to stress prior authorization confirms medical necessity only. It does not guarantee payment. So even if we get prior authorization, we will proceed then with the test or the treatment, and it might come back denied later. And if that happens, you're going to see a big bill that you're responsible for. That is a trigger for you to call the care team, reach out to someone and let us know, because we want to look into why was that not covered. There could be a lot of reasons why, but we want to know about it. And then again, being proactive as much as possible and follow up with patient account services here at Mayo Clinic, which is the business office. Those staff, along with your care team, we're all here to help you address any of those concerns. Unfortunately, with insurance, the thing that I think is so hard for myself, for Amy, for the care team is we can only do so much work proactively. A lot of this, we have to be reactive. So it's not uncommon. Again, that's why we want to stress, it's not uncommon that you get a denial. It's not uncommon that you get told by your insurance company, no. We expect that, but we have to react to that. And a lot of times we're just waiting to see what it is we need to react to. And again, letting us know so that we can stay on top of things and keep things moving. I think that's the thing that we really want to stress. Amy, what would you add?
I think this is a good example of where your case manager can be really helpful at the insurance. So not only calling us at Mayo Clinic and letting us know about an issue, but also call your case manager. That's their job. You've called, you've done your due diligence to make sure it's medically necessary, and now you still get this bill. Call your case manager. Please call us too, but it's okay to call your case manager as well. The other thing I would add is sometimes getting things done in person really can have a better outcome. So know that the Mayo Clinic sites, we do have business office representatives that you can meet with one-on-one in the buildings. So when you're here for care, feel free to bring in those statements that you're confused by, don't understand, and meet with those staff in the various business office areas. I can appreciate that doing things over the phone doesn't always help. You get mixed messages, get different people on the phone. So it's okay to do that. And then the only other thing I would add is don't ignore. We know you're angry. We know you're upset. We know you're frustrated. You probably feel like your head's ready to explode. It's another thing on your plate. We hear you. We understand. Please don't avoid these situations. We can only help you if we know what's going on. That would be what I would add, Angie.
Thanks, Amy. Excellent points. So a little organization goes a long way. And for every patient, everybody has different organizational skills and different processes work for different people. So we're not here to tell you, put everything in a binder or make sure you organize it by months. No, all we're asking is that with a cancer diagnosis is going to come a lot of extra paperwork or a lot of extra statements that might come via email if you have electronically elected to get that. All we're saying is just keep things in one area. So if we have to go back through any of the paperwork or we need you to dig, it's easier to go back and grab that one box or that one binder or that one envelope, whatever that organization tool is for you, so that we can start looking through that paperwork instead of it being all the insurance paperwork is mixed in with the monthly bills and all the junk mail that comes to the house and everything. So if we can just pull the insurance stuff out, pull the medical stuff out and put it in one spot, that is a good starting point. Pay attention to your bills. Again, like Amy said, we cannot stress enough. Please, please do not ignore anything. Question. It's okay to question. If something doesn't look right, let's investigate it. Let's look at it. If it looks odd, like this didn't look like the last month I got this chemo treatment, this charge looks different than that time. Well, let's look into it. Why does that happen? We're humans. We could have made mistakes on the coding side of things. Insurance companies could have made a mistake on their side. Let's look into where we have an issue, or if we even have an issue. So it's okay to question. Some patients like to match their medical bills to their explanation of benefits. If that's your style and you want to be that organized, you certainly can. Otherwise, just having it all in one spot is a good start. And then making sure you keep all your paperwork. So not just the things related to your insurance company, but if you got any over-the-counter medications and you got receipts for those, hang on to those. Receipts for lodging, travel, any type of phone calls you had with your insurance company, any FMLA paperwork with your employer, all of that should be kept in one spot. Anything related to this cancer journey is helpful if you keep it in one spot, so that if we need to go back ever and look for any of it, you have one location that you're pretty sure it should be in. Amy, do you have anything to add?
I would just say that, cancer sucks. You are in the fight of your life, and we get that. You know that better than even we do. And then you got to take on all this paperwork for insurance. And we're teaching you to call and get case managers and understand new terms you've never heard before. This is a great time for those family members, those friends, those people in your life who said, how can I help? What can I do? If you know them and you trust them and you're comfortable with them taking on this part of your cancer journey with you, this is a great way to get them involved, because it is a lot. And we do acknowledge that you're already fighting for your life. Fighting with insurances does not feel fun. So this might be a good opportunity to get those people whom love you and want to support you involved.
Perfect. Yes, we're always looking for ways to have our caregivers and friends and give them tasks to do. So that's an excellent point, Amy. So this slide here is just to kind of talk about who is your care team, and again, highlight those things that we want you bringing to our attention. So anything around paying for your medical bills, paying for your medication, any expenses related to travel, lodging. If you have any concerns about a potential job loss, whether that's the patient or another household member, potential loss of income, any type of loss of insurance, we want to hear from you. Please express those concerns as they arise. Again, sometimes these things will be early on in the cancer journey. Sometimes they'll bubble up 3 and 4 months later. Please just let us know as they come up. Your care team is defined as your medical team, your providers, your nurses, your business office. We have financial counselors, social workers like Amy, myself as patient navigator, and then our folks in the patient account services who help all of us. They're sort of the they're the glue that holds us all together in terms of the insurance and the billing stuff. But oftentimes we will engage them after we have a better understanding of what the concerns are. So this last slide here is a list of resources that we want to just make sure people are aware of. These are 4 excellent national resources that you can use to connect with additional information. If you're interested in learning more about any of these topics that we talked about, you will find any of that information on any of these websites, and the links will be available too.